Hello friends, I am Dr. Samip Gupta, physical therapist. Today I am going to talk about physiotherapy interventions in Covid-19 patients. So friends, this has been really tough time for everyone to deal with certain emergency situations where there was lockdown period, and still I continued my services towards patients who needed timely interventions of physiotherapy and rehabilitation for their early mobilization and quick recovery. So I also dealt with patients who were not suffering from coronavirus, but then they had other complications like fractures due to fall in old age. Then there are other complications like stroke attacks. Then for diabetes there was peripheral naturopathy. So all these patients were continuously going on, and I was trying to help them out by providing my services through telecommunications or going them and seeing them personally at their respective houses by taking all due precautions, and have also treated COVID-19 patients. So first of all, briefly, I'm going to give you a brief introduction about this virus. Coronavirus, the size of this virus is anywhere between 30 nm to 120 nm. Okay, we have earlier faced with similar kind of viruses throughout the world. To name them, we had H1N1 influenza virus, then we had SARS coronavirus, then we had Middle East respiratory virus, and then finally this year in 2019 we were faced with terrible situations with COVID-19, that is coronavirus again. So friends, this virus, it gets into our human system by most commonly, which is called infectious droplet. It gets transmitted through infectious droplet, or if you touch a surface where there is already a virus lying down, you can pick it up through your hand, and then if you touch your hand to your face, to your nose or to your mouth, you can get this virus into the system. So first and foremost, to prevent this, the first primary entry of the virus into the system, all you need to do is wear mask, frequently sanitize and wash your hands, okay, and avoid touching your hand to your face. This is the best possible way where you can avoid from getting infected by this deadly virus. Now this virus, they basically enter into the system. Its symptom onto the patient depends on the severity of the viral load into your system. That means if you have spent some good amount of time with a person who was already infected, then there are possible chances that your symptoms can get to more severe degree. So first of all, it starts with very basic, that is someone might get running nose, someone might get upper respiratory tract infection, and then if it gets too severe, then it can lead to a pneumonic patch or a severe acute respiratory distress leading to death, which accounts to 2% of our total population. So this virus has an incubation period of between 2 to 14 days. That's where it survives into the system and also multiplies depending on its DNA, RNA replica. So once it gets into the system, and then what it does is it gets into our respiratory tract, it goes into upper respiratory tract, then comes down more lower to lower respiratory tract, and then finally enters the lungs. Now, in lungs, we have these small sac-filled air cavities. Now, these sac-filled air cavities are present throughout the lungs. Okay, so this virus gauges entry into the system, into the lungs, and finally collapses those terminal small sac-filled air cavity. That's how your lung collapses, and then you get this breathlessness symptoms. That's the main causative factor of the virus, that it gets into the lungs and damages the respiratory bronchioles. So now physiotherapy is of great help in treating such conditions, whether it's a pneumonic patch or whether it's a corona affected patient, okay, getting this problem of lung collapse. I have dealt with such patients while through this pandemic which was going on, and I have personally seen patients who had got affected with coronavirus. So their symptoms were somewhere between, they had fever. Apart from fever, they had mild to moderate breathlessness. There was no severe breathlessness which was reported. It was more due to panic attack, I suppose, because it depends on multiple other factorials how the virus affects your body and how severe can it get to you. So that's how now physiotherapy is going to play a major role in treating patients, and I've got excellent results by doing some simple physiotherapy exercises, what we call it as a chest physiotherapy for dealing with such patients who has got pneumonic patch or have a collapsed lung. What we do is called chest physiotherapy. So very simply I have explained with 4 points how you can get doing this. So the first one is the position. So now the positions, anyone who feels even slightest of breathlessness, not severe, very little, simply by adopting this position, all you have to do is get towards the back support of the sofa or a bed, put a pillow, and you can upright your body to almost 45-degree angles, and that's how you position yourself on the bed. That's number one position. Number two position is simply lying on your stomach. The moment you lie on your stomach, because the lungs are on the back side of your body, on the posterior side, both these positions will facilitate more air entry into the lungs. So simply by adopting this position, you can facilitate air entry into the lungs. So this is a very easiest way where you can help someone, or you can do by yourself to avoid any kind of breathlessness. Coming to point number 2, what we call is manual, that is percussion therapy. Now this particular aspect where we manually, what we do is we make the person sit, and behind his back we use this cup size hand. This is called cup size hand, and then we do cupping behind his back. That is on the posterior, on the upper back where the lungs are placed into the body. So that's where when we do cupping therapy, that is called cupping behind on your upper back for around 5 to 10 minutes on both the sides. By doing this, by manually percussioning it, we are going to stimulate the lung expansion. So that's how we are going to achieve, we are going to revive that collapsed lung, the terminal bronchiole, and get it back to its functional capacity. So that's number 2. Number 3 are the inspiratory breathing exercises. So they are very, very basic 2 important breathing exercises. That is inspiratory breathing exercises. They are number 1, where you have to keep your hands on your chest, slowly breathe in through nose and blow through your mouth. So I keep my hands on my chest to gauge my chest expansion, how well it is expanding. That will stimulate that particular aspect of the lung and helps in air entry. So you put your hand on your chest and you breathe in through your nose, expanding your chest, and blow out. That's number 1. Exercise number 2, for the same inspiratory breathing exercises, you cross your hands around your chest wall. This is your chest wall, you cross your hands, and again you breathe in, expanding your side chest. So my focus is to expand my lower rib cage. So I'm going to put my hand around my rib cage and feel the expansion. As I can feel, my hands are going wider and then blowing out. That's the inspiratory breathing exercises. Now the last one, which is called the expiratory breathing exercises. This exercise is very beneficial who are suffering from acute breathlessness. In other words, what we call this as pursed lip breathing. In pursed lip breathing, as we try to whistle, so you're going to do that. If you feel breathlessness, you're going to purse your lips and exhale air out. You're going to again take a short breath in, and that's you purse your lips exhale out. By doing this, you can reduce your severity of breathlessness. And the last exercise, a very simple exercise which you can do it at your house also, is simply take a glass of water and put a straw in it and try to form bubbles in the water by simply blowing it out in the straw. As you make bubbles for a longer time, that's going to help your lungs to breathe better. So this is how you can help yourself from worsening your conditions, and you can come out more successfully. I give you this advice to not to panic if you get into this situation, and try these basic chest physiotherapy at home, and you will feel a lot better. Thank you so much.